Case scenario of a 5-year-old girl with generalized convulsion, then post-ictal with GCS 10, BP 95/60, respiratory rate 54, heart rate 110. What sign indicate increased ICP? So, the Kussmaul's breathing occurs in metabolic acidosis. Kussmaul's breathing is a deep and labored breathing pattern, often associated with severe metabolic acidosis, particularly diabetic ketoacidosis, but also kidney failure. It is a form of hyperventilation, which is any breathing pattern that reduces carbon dioxide in blood due to increased rate and depth of respiration. In metabolic acidosis, breathing is the first rapid and shallow, but as acidosis worsens, rapid and shallow, as the breathing gradually becomes deep, labored, and gasping. It is the latter type of breathing pattern that is called Kussmaul's breathing. Again, in metabolic acidosis, breathing is first rapid and shallow, but as acidosis worsens, breathing gradually becomes deep and labored and gasping. It is the latter type of breathing pattern that is referred to as Kussmaul's breathing. But in increased ICP, Cheyne-Stokes respiration is also known as periodic respiration. But in increased ICP, Cheyne-Stokes respiration, also known as periodic respiration, with cycles of respiration that are increasingly deeper, than shallower, with possible periods of apnea. But in increased ICP, there are Cheyne-Stokes respiration, also known as periodic respiration, with cycles of respiration increasingly deeper than shallower, with possible periods of apnea. Causes include brainstem lesions, that is cerebrovascular event, encephalitis, raised intracranial pressure, heart failure, chronic pulmonary edema, and altitude sickness. Lateral radiograph of the skull shows multiple well-defined lytic lesions. Lateral radiograph shows multiple well-defined lytic lesions, geographic circle, suggesting Langerhans histiocytosis. Skull X-rays weak on keynotes. In contrast to cryptogenic and remote symptomatic causes were more cryptogenic and remote symptomatic causes were more common in older children than in younger children. Causes of status epilepticus vary significantly with age. De Lorenzo et al. Reported that in patients younger than 16 years, the most common cause was fever and or infection, 36%. In contrast, this accounted only 5% of status epilepticus in adults. In adults, the most common precipitant was cerebrovascular disease, 25%, whereas this factor caused only 3% of pediatric cases. In a more redefined study that focused on children, Shinnar et al. Found that in children younger than 2 years with status epilepticus, more than 80% of the cases were febrile or acute symptomatic in origin. In hemolytic uremic syndrome, renal failure, for seizure control, consider consider prophylactic phenytoin. In hemolytic uremic syndrome, renal failure, for seizure control, consider prophylactic phenytoin in patients with neurological symptoms. 20 to 40% of patients have seizures in children than in younger children. In hemolytic uremic syndrome, renal failure, for seizure control, consider prophylactic phenytoin in patients with neurological symptoms. Common solid tumor in toddlers. Common solid tumor in toddlers is neuroblastoma, not nephroblastoma. Common solid tumor in toddlers is neuroblastoma. During the first year of life, embryonal tumors, the most common neuroblastoma, followed by Wilms tumor, nephroblastoma. Common solid tumor in toddlers is neuroblastoma, followed by nephroblastoma. During the first year of life, embryonal tumors, the most common is neuro, followed by nephroblastoma. Landry ascending paralysis is recognized in Landry ascending paralysis is recognized in Guillain-Barré syndrome. Patients must be infantile botulism. Landry ascending paralysis, a particular virulent form of Guillain-Barré syndrome. The disorder often becomes like flu-like illness that brings a general physical weakness, but is then characterized by rapidly progressing paralysis that starts in legs and arms and may move on to ascend to affect the breathing muscles and face. Treatment of Guillain-Barré syndrome. IV immunoglobulins, hemolytic hypoxic ischemic injury, most common associated with parasagittal. Parasagittal is spastic quadriplegic CD. Hypoxic ischemic encephalitis, HIE, encephalopathy. Hypoxic ischemic encephalopathy, most common associated with periventricular leukomalacia. PVL is spastic diplegic species, but most commonly associated with parasagittal. Parasagittal is spastic quadriplegic CP. A child with fever, GCS7, fever, focal seizures, MRI showed temporal lobe enhancement. This is herpes simplex viral encephalitis. Child with fever, GCS7, fever, focal seizures, MRI showed temporal lobe enhancement, HSV encephalitis. Contraindication of lumbar puncture, except contraindication of lumbar puncture, local skin infection, yes. Increased intracranial pressure, yes. Impending cerebral herniation, yes. Platelets less than 50,000 is not a contraindication. Platelets less than 50,000 is not a contraindication for LP. Contraindications for immediate LP. Contra indications for immediate LP is evidence of increased ICP other than bulging frontal LA, such as third or sixth cranial nerve palsy with depressed level of consciousness, or hypertension and bradycardia with respiratory abnormalities. That is evidence of increased ICP, such as third or sixth cranial nerve palsy with depressed level of consciousness or hypertension and bradycardia with respiratory abnormalities. Severe cardiopulmonary compromise requiring prompt resuscitative measures. Severe cardiopulmonary compromise requiring prompt resuscitative measures for shock or in patients in whom positioning for LP would further compromise cardiopulmonary function. Infection of skin overlying the site of LP. Thrombocytopenia is a relative contraindication for LP. If an LP is delayed, empirical antibiotic therapy should be given. Signs and symptoms of meningitis in an infant can be different than those in adults. Signs and symptoms of meningitis in an infant. Which of the signs and symptoms of meningitis listed below is more helpful in an adult patient than in an 4-month-old, and why? लेथर्जी कैन इन्फेंट का रहता है, वॉमिटिंग रहता है, हाइपोथर्मिया रहता है, जॉन्डिस रहता है. Meningeal signs are negative in infants because of open anterior fontanelle and immaturity of CNS reflexes. Meningeal signs are negative in infants because of open anterior fontanelle and immaturity of severe Brudzinski's sign. The signs and symptoms of meningitis in an infant can be different than those in an adult. Which of the signs and symptoms of meningitis listed below is more helpful in an adult than in a 4-month-old child is Brudzinski's sign. Why the meningeal signs are negative in infants? Because of the open anterior fontanelle and immaturity of CNS reflexes. Left pneumothorax, infant with shock. Left pneumothorax, infant with shock. Best treatment is resuscitation with fluid chest tube. You have to put immediate chest tube. This needle of any needle also. Perhaps infant with shock. The best treatment is resuscitation with fluid and chest tube. Chest tube.